Well, a woman suspected of having Ebola this morning is now being treated at the University of Colorado Hospital in Aurora. Earlier today, her blood test turned up negative at a Loveland hospital, but doctors are continuing to monitor her. 7 News reporter Lance Hernandez looking into the latest developments. And Lance, this woman has made extensive trips to Africa.
She works for a humanitarian aid organization, an international organization, and had been working quite a while in Ivory Coast. Now, normally federal officials do a good job of tracking people who are traveling to the U.S. from Ebola-affected regions, but for some reason this woman wasn't on their radar. Now, she had come to the U.S. to visit some friends in northern Colorado. That's when she came down with a fever, called for an EMT. They took her to Medical Center of the Rockies. Medical experts there drew some blood, sent it out for testing. It turns out she does not have Ebola. At a news conference earlier today, I asked about the gaps in that tracking system.
This individual had what we call a broken itinerary. That means that this person traveled from an Ebola-affected country to a non-Ebola-affected country in Africa and stayed in that non-affected country for several days before traveling on to the U.S.
Now, Rachel Herlihy of the State Health Department says they've had conversations with the Centers for Disease Control about those gaps. She says the CDC is looking into it, but she also added it is very difficult to track people who travel to multiple countries, as this woman did. Reporting live in Aurora, Lance Hernandez, 7 News.